Okay.
Okay.
So I'm just repeating. Today we will going to do a development case where you have to talk with grandmother Tengu about Megat, who is 4 years old, and grandmother having concern with the development, especially how she walk and how she move. And here your task is motor.
Okay. So
Start.
good evening, Madam Tengku. I'm Dr. Yang, one of the children doctor here. I'd like to talk about Megat, your granddaughter. How are you feeling today?
Yeah, doctor, I'm very much worried about Megat actually. So I'm here. Yeah.
Yeah. Let's see what I can help you after I take some history from you. So Madam Tengku, may I know what exactly is your concern? Since when did you have that concern?
Yeah. So actually, I'm look after Megat for the last 2 years. So I see that she is different way of walking and moving. Everything is concerning to me.
Okay. Has she had any skills that she has previously acquired but she has lost it?
No, doctor.
Okay. Does she have any eye or hearing problem?
No, doctor. I have no concern with this.
I see. She has any behavioral issue that you are concerned with?
No, doctor.
Okay. Does she look like her parents?
Yeah, typical of her mom, and some similarity with me as well.
I see. That's good. May I know what is the language that Megat speaks at home?
Yes, only one language.
Okay. So far for past 2 years, have you brought Megat to see any doctor or get any medical advice?
So actually, I just know about this last 2 years issue that time to time I'm taking for different cause like nasal discharge, fever, cough, like this.
Oh, okay. All right. I see. I'd like to know a little bit more history about Megat. When Megat's mother is pregnant with her, did she have any problem with the jelly scan?
Yeah. Actually, that time I have no contact with my daughter. Maybe jelly scan was done. Yeah, but I don't know
Or
anything special.
all right. So that's okay. Do you know if she had any fever or rash during the pregnancy, or any medication that she's on?
Probably no fever or like any infection or any other problem. That time, just I came to know from distant relatives that she was okay. No
I see.
medication that time.
I'm sorry to ask this, but was she on any alcohol when she was pregnant? Megat's mother.
Sorry, can you please repeat?
I'm sorry to ask this. Was Megat's mother on any alcohol when she was pregnant with Megat?
Oh, doctor, she was alcoholic. Yeah, she was alcoholic and before pregnancy. So I think she was with this in the pregnancy time as well.
Okay, I see. So when Megat was born, was she born at the right time?
Probably she was in right time. I was not that time with her.
Uh, do you know what was her birth weight?
I see from the documents that she was 3 kg.
3 kg. All right, that sounds like a good weight. So, do you know if her mother had any issue during delivery?
Um, no, that was smooth. I mean, she was delivered and then returned to the home on the second day.
Okay, I see. So after delivery, she during the first month of her life was Megat admitted for any reason?
Actually, after delivery, everything was smooth. But at the fifth day, she Megat required again hospitalization.
What was that for?
Mm, So she was excessively crying, and yeah, so that time, um, she was her behavior, maybe doctor was suspected that something wrong.
Was any diagnosis given?
She was admitted. Yeah, that time, she was admitted, and for the at least 2 weeks that I came to know.
What was she? Do you know if she was any investigation was done?
Mm, Regarding test, yeah, some test was done.
Was there any brain imaging?
Yeah, brain imaging was done.
How was the result?
So I'm not sure, but some problem in the brain.
Some problem in the brain. I see. So was there any other procedure done, like taking the fluid from the back of
No,
her
no, no, doctor.
spine?
No, I'm not
Or
sure. It was not.
so for the 2 weeks, was she on antibiotic?
No, she was admitted, but not antibiotic or any fluid.
Did she have any issue like fitting?
Sorry, bleeding?
Fitting, like abnormal movement or fitting?
Oh, doctor. No,
Okay. Has she undergone any operation?
no,
Any major trauma before?
no,
No. So after that, after she was discharged from work for the 2 weeks, was she admitted for any other reason?
no, 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 no.
All right. Was she under any follow-up after the discharge?
Maybe follow-up given. I was not with my daughter or granddaughter.
All right. So was she on any medication or any medication
One
that
second.
she's still having now?
No, no. So
No.
only, I mean, some physiotherapy is given.
She's still under that physiotherapy?
Yeah.
Okay, all right. I'd like to ask some question about her development. So,
Mhm.
for what how's her language? How she can speak in how many words? She can join words,
You can say many words. Yeah, two-word sentence is there.
2 word sentence. Can she ask questions?
Yes, two-word
Okay.
sentence. Ask questions. Yeah,
How about 3 word sentence or even longer?
yeah.
Tell stories.
She can say songs.
She can sing songs. Okay. Can she tell stories?
No,
No, I see. How about command? How many step command can she obey? Like if I give her a 3-step command, can she
uh,
understand?
she can do twist command.
2-step command, okay. How about body parts? How many body parts can she point to?
Yes, she can point three body parts, five body parts even.
5 body parts, I see. That's good. How about noun or verb? Can she understand all those things?
Yes, she can understand verb.
Okay, all right. So how about her toilet? Is she toilet trained or is she still on diapers?
She is still on diaper.
Both day and night.
Yeah,
All right. Can she dress herself and or undress herself?
require help.
Sorry, require help.
Require help. Require help. Yeah.
All right. So how about eating? Can she eat herself?
She feed with the spoon. Yeah.
She can. All right. Eat with a spoon and a fork.
No, fork is difficult for her. Okay, time is up.
That's
Um,
very fast.
yeah. Okay. So give summary.
uh, I've talked to Madam Tengku, grandma of 4-year-old Megat, with the concern of gross motor and fine motor delay since 2 years ago when she started taking care of Megat. Megat had history of emission at day 3 of life for probably a brain pathology, but and was under physiotherapy since then. But grandmother wasn't sure of the exact diagnosis. She showed global development delay as her receptive speech correspond to about 2 to 2.5 years old, whereas her expressive speech is about 3 to 3.5 years old. Sorry, 2 to 2.5 years old as well. So for her social history, she's about 2 to 2.5 years old. I should get a further history of the family history and also a psychosocial history.
So what's your idea?
I think that I haven't reached to the part about the parents.
Okay. Okay. So if you get score, so in the real exam they will not give you any idea. That's true. If you cannot reach, so what I should say that your history is amazing. Really, you did a very good history. So you don't destroy your way of talking that you did. That is okay. That should be continue. You should not, you should not change it. So what you ask one by one, it was okay. But it's like you have to think that when I completed I have to take all the history within the 6 minutes time. Okay, get it? Within the 6 minutes time, you have to complete it because you have to ask then 1.5 minutes all the developmental history, and then another 1.5 minutes family and social history. That's the things you should always keep it in your mind. So you ask the when it's happened and all the things, pregnancy, delivery, and the post-delivery. So just whenever you ask alcohol, please also ask that smoking, also smoking, because alcohol and smoking have some issues, and smoking can affect on the placenta, and then it can lead to hypoxemia, and it is also can be a cause of IUGR whenever there is IUGR. And those who are alcohol addict, they also can be addict with the smoking. And then whenever you ask all the questions, you should also include skeletal survey, imagine, and also if you suspect the cause, then actually. So then whenever you ask that, it's really very important. And please, all of you, Glory, Afsana, don't forget this. She asked for the long time you admitted. So in that times, do you require any antibiotic therapy? Is in that time fever? Is require any fluid from the lower part of the back? So it's very important because she was thinking of meningitis. But what you do mistake, whenever I say it for the last 2 years and I have no relationship with my child, so I'm just taking care of my granddaughter for the last 2 years. In that time, you have to ask that what happened before 2 years, who is taking care, is her mother or other than anyone. Here is the clue. Okay, because why grandmother is taking care, it's a issues. Not every time grandmother is doing taking care. It's not very natural things that grandmother is taking care, and mom is not known anything about her daughter pregnancy, delivery, and she said no, I have no contact with that times. That means here is something problem. Now you have some suspicion what could be the cause? Afsana, you should heard it later. Okay, Afsana, you should heard this scenario later. Okay, so it's a scenario of second baby syndrome. Get my point? Yeah. So that it came like foster care. who is taking care of the child, you know, foster care. So so it's like scenario would be can be like this way. You have to talk with the foster parent, foster mother. So also she will say everything. She could not any answer. She have no answer actually. She will say, no, I don't know, I don't know, I don't know, I don't know. But here is the clue. Why foster parents and what happened around this time? So long time hospital stay without fever, without things, what could be there? In that time, is social service involved that time? It could be another clue. Yes, the child was given to the social service, and she was managed by a foster parent. Okay, after 2 weeks of birth, because she was addicted with alcohol and drugs as well. If you ask, then I would say drug, alcohol. Drug means not medicine. You first ask about medicine, then drug, then alcohol. But she was also addicted with drug. But yes, really in the exam, they will not give you so much drama, inshallah. I mean, it's not all the times they will make drama. Sometimes very few case drama, but most of the time they said everything opened up, like yes, alcohol, addict, and something. But if it is not there, I'm just making this thing so that you can get the clue. Okay, so I'm making it difficult, tougher, but real exam will be easy, inshallah. Okay, so here one of the things, so you understand that clue is here. Skeletal survey you have to ask, and social service involved or not, who is taking care before 2 years of birth. So it should be in your mind. And the imaging is also done. The child having no fever, no fits, still imaging done. Why? Something there, na? And so, you know, child was vigorously, if you ask more, maybe they will say, child vigorously shaken after birth. Child was vigorously shaken. And sometimes some clue also there that some meningitis features is also there. But whenever this scenario is there, that child was admitted, and then skeletal survey, brain imaging was done, and then child given to the social service, then the grandparents take over. So it is shaken baby syndrome. And shaken baby syndrome means, having idea, shaken baby syndrome?
Yeah.
Intracranial hemorrhage.
Yeah.
Intracranial hemorrhage, but it was when the child was like intentionally shaken. And if you ask what about the child mother age, then I will say it is 17 years. So why you were angry with your, if I said you that I'm at that time angry with my daughter, what's the problem? Can I know around this time what happened? So my child was here married with her boyfriend, and I was not liked it, so that I not meet up with my daughter. We'll leave her. And here important is family history. Can you please elaborate me about your family? What happened? What about Megat mother? Megat was with that time. What about the father? Who is the army member? How you are doing these things? Are you feel here difficult because at this time taking care of her? So who is helping you? Grandmother is very much depressed, you know. She was aged and she had taken care, because she was thinking first, no, she will not take the responsibility, but now she's taking care. What about the Megat mother? How is she now? She is in the prison, you know. Here she is in isolated in prison. She is, because she doing some she did some antisocial activities, and something could be there. So the scenario could be different, like Megat is addict, so she is in drug rehabilitation center. So anything can be. Something will be in the family and social. Okay, but I strongly believe if you get a clue, then you can make it. Okay, but don't overthink about this timing issue. It will be correct. with the practice, because we just started practice. So everyone timing will be rolled up. Okay, with the time it will be rolled up, no problem at all. I did not know anyone who cannot perform for the time, but they could not picked up the case, could not get the clue. That was the issues. So be comfortable, but your way of asking questions and everything was there. So developmental history, if you understand the age, then it would be okay. Okay, now started examination or assessment.
Doctor,
I
I
have a
have a
question.
question.
I have a question.
Yeah, which question? Continue, Glory.
For the information about skeletal survey, what question should I ask? Direct,
So, so you should ask in that time what other test was done. So you say that any imaging was done. She said, then I said CT MRI. Yes. So other tests, any X-ray of different kinds of bone, different bones. So it is invariably less than 1 year. Any child, non-accidental injury, CT MRI and skeletal survey must. Less than 2 year skeletal survey. Okay, and less than 1 year CT MRI. It is must.
okay.
Doctor, can I ask, because I have limited time, I don't know which part of the history that is redundant that I shouldn't have asked to save
That's
time.
a big question. That's a big question. Actually, I did not get any unnecessary question you asked. Really, your talking history was appropriate, but
not
you
enough
become
time.
slow. Yeah, you become saying you become slow after when I ask question after taking the. I mean, in between time you become slow. I mean, when you understand that I could not get the course, then you become slow and you become hesitant. What I feel.
Oh.
So if you not hesitate, then it will be okay.
Then maybe I'll have enough time. Okay.
And then another things is examination. You can whenever you feel that your time is not appropriate, so just reach to the age and go next. And whenever it is not online, then you will get 1 minute, at least 1 to 2 minutes extra, because I'm telling in one test, but for the internet and many issues you can make, because you have to just heard, then you will again say, and then I heard, and you can feel that she is slow, but I feel you are slow, like this
okay.
way. Okay,
The
so
lagging,
in a
okay.
really, if you, so believe me or not, no one complained that time is the issues in the real exam. But yeah, it's true that if you not practiced, then you will not get enough time. But if you do these types of practice regularly, then of course timing will be not an issue. If you practice, but if you think that no, I will not practice anymore, my timing is not issue, then you will not get it. Okay, so focus that you are taking appropriate history or not. Now you will focus on this, you can get it. Just if you get 1 minute or 1.5 minutes extra, then you can complete it. Another point, if you ask in the speech developmental history, you can wrap up with less question. So whenever you feel that 6 minutes up, so I have to do developmental history and I have to do the family and social history as well. Okay.
Okay.
Now do the developmental assessment. Okay.
Yeah.
So 7 minutes for both, and then 2 minutes. It is not written in the RCPCH, but it should be like this. So practice should be 7 minutes and 2 minutes. Okay. So I will tell you 7 minutes up.
Okay, so I'll start. So I'll sanitize my hand, get permission from the grandma to play with the child. So good afternoon, good afternoon, Madam Tengku. Dr. Yang here. I'd like to play with Mega. Is that okay?
Yes.
So I will try and build rapport with Megat and at the same time get an impression about her mentality, whether she's alert, how's her growth chart. I like to plot on the height, weight, and hip circumference.
So height, weight, head circumference, normal.
Normal, all right. Then I'll see if there's any supporting aid like wheelchair or spleen.
No.
Okay, so whether she's dysmorphic.
No.
Okay, so I'll see what Megat is doing.
Mega is just sitting.
Sitting, all right. So I'll go to Megat and say, hi Megat, can you walk with me? So can she get up from the chair and walk towards me?
Yes, he get up and started walking forward.
Okay, so then I demonstrate to him to her to walk backward. Can she do that?
Yes, backward.
All right, then we go sideways and tiptoe. Can she do that?
Cannot back sidewalk and not tiptoeing.
Okay, so then I will show Megat to run. So I say, Megat, let's run towards grandma. So can she
No,
follow me?
whenever he's doing these things, only one side running possible, but another side is difficult.
Which side is difficult?
Left side.
Left side is difficult. All right. So I will try to ask Megat to stand on one foot, whether she can do that. So if she stand on the right foot, can she balance herself?
She cannot balance actually in one foot, and it's more difficult on the left side.
All right. Okay. Next, we'll play the ball. So I'll bring out a ball and ask Megat to kick it. I kick it to Megat and ask her to kick back. Megat, try to kick this ball.
She can kick the right side on the foot, on the place, but she can't do with left side.
So was it a forceful kick of the right side?
Yes, she can do it forcefully, but not at running.
Okay, so then I will throw the ball towards Megat and ask her to catch it. Megat, catch this ball. So I throw towards her. So can she catch it? How does she catch it?
She try to catch with the hand, in the right hand, but not in the left hand.
Okay, so she can catch it or she managed to catch it with one hand.
She tried to manage it, yes, catching just with the flexed hand she can do, but in the right side only.
Right side on the right side only. All right. So then I ask grandma if there's a stairs, how usually Megat go up and down of the stairs.
She can actually require help, but with the per stair 2 feet required.
Okay.
Difficult more on the left side.
So I will ask Megat to walk again. I would like to assess her gait. So what kind of gait is it? Is it a hemiplegic gait?
So gait, she's making a half circle during the walking, especially on the left side.
Okay. All right. Next, we will go to fine motor. So I will bring out a crayon and a paper. First, I'll bring something bright and assess her vision grossly. So I'll ask her, Mega, follow this ball. Can her eyes go follow, fix and follow?
So yeah, she can follow.
She can follow. Okay. Then I pass her the crayon. I pass towards the left side. Can she catch the crayon and hold it in her hand?
She catch the crayon with the, with the 4 fingers.
4 fingers. Right hand.
Yes.
4 fingers means with the thumb downward.
Yes. So I mean it's called quadriplot.
Sorry.
Quadriplot. 4 fingers quadriplot.
Okay. So how then I ask her. I will show her how to draw line. Can she scribble? I show her how to scribble. Ask her to follow. Can she do that?
The right hand she can make yes, she can make horizontal line, vertical line.
Okay, so can she draw a circle?
Mhm.
Can she draw a circle?
Yeah, she draws circle, but it's not like appropriate.
Okay, so then I will ask her to use a plastic scissors, put away the crayon and use the plastic scissors. Can she use the scissors? Can she hold it?
She can not use appropriately with the plastic scissor. I mean, she cannot cut, but she can hold.
Using which hand?
No, she can just use one hand for this.
Okay, then I'll pass her a cube. So which hand is she using to hold the cube?
No, she's not using both hands. With one hand, she can make 3 cubes tower.
3 cubes tower. Which hand is she using to make the tower?
Right hand.
Right hand. Okay. Then I will pass her a board and the other shapes. Then I ask her to fit the shapes into the boards. So how many shapes can she do?
Both. She can make 2 simple shapes.
2 simple shape. Okay. So then I will give her a book and whether she can flip the book. Mega, let's read the book. So
She
how
can
does she flip the book?
yes, one by one, 7 minutes up. Make your summary.
I've had the opportunity to play with Mega, a 4-year-old girl. I've assessed her gross motor and fine motor with the chronological age of 4 years old. She has global development delay. She shows discrepancy in side of the side of the body, as in the left side is weaker, the left lower limb is weaker, and she is likely to have a hemiplegic gait. The development age correspond to 2 to 2.5 years old, whereas her fine motor is also of 2 to 2.5 years old. By her upper limb, she shows likely a weakness over the left side, yeah, as well.
Okay. So
Okay,
tell me, what's your idea? Why the child had this problem?
So given the history of likely a shaken baby syndrome, the child is may have suffered from insult to the brain, causing a left-sided hemiplegia.
Okay, so the brain is itself influenced. Anything more behind it other than you say it's shaken baby syndrome? Yeah, so anything more can affect global developmental delay?
There could be a cerebral palsy because of that.
No, why not? Yeah, so
Yeah.
then
Then there could also be some maybe a top block. There can also be some element of lack of stimulation, whereby
yeah, so child is neglected.
maybe but I need to explore the social history more
Yes, so
because
child is
the
not
parents are
appreciated.
not in the picture.
Yes, so parents are not, but there is many issues are there. So child is not properly taken care, child have not get proper stimulation, and here neglect is one of the most important cause of
Development delay.
it is the most common things which can affect the child. Those who have parental issue, it can make it delayed as well. And you should say that I have to explore more. So clinically, what I get, that this can be issues, and child having any other metabolic issues or genetic issue, I have to explore. It could be there. And parent having, a mom having alcoholic. So I have to look for any fetal alcohol syndrome is there or not. Okay. It's not excluded. The child is not child is not out of fetal alcohol issue. Although fetal alcohol syndrome, if they are, then they have some syndrome and they have some cardiac issues. So you will say these points. Although these are the points for fetal alcohol syndrome, but I did not get anything. But I have to look for. Okay, so you have to look for it. Could be metabolic, genetics, syndromic, many things could be, can lead to these issues. And child was, mom having alcohol, medication, and that time child was, there could be placental issues. So can be trauma to the tummy also can affect. So, and to the pregnant mom, and then it can lead to some effects on the child's development as well. So less blood supply to the, so whatever you know, but you will say this neglect issue, lack of stimulation, and the shaken baby syndrome. Okay, bleeding into the brain due to force. Okay, then yeah, what's your plan? What you want to do for this child now?
So I would like to do a full physical examination, especially on the central nervous system. I like to check for the to get an idea of the hemiplegia. Then I also need to do a nutritional assessment of the child. Then refer the child for a formal development assessment, formal eye and hearing assessment. Then need to do some investigation, including baseline blood investigation like food blood count, renal function test, liver function test, and the bone profile, including the ALP, vitamin D, calcium phosphate. Then also do an imaging for the child to see to look for the such as MRI brain, to look at the any brain pathology or structural brain abnormality. I will refer the child to the child should be managed by a multidisciplinary team, including development specialists, to have a tailored plan for early intervention program for the child. Then refer the child to neurologists in view of the weakness and the neurological deficit. Then the child should be, the thyroid function test as well for the blood investigation. Then the child should be under the follow-up of physiotherapy to increase the muscle strength, prevent contracture, fine motor follow-up to help with the activity or daily living, the play or any spleen if the child required, any orthosis, and also speech to assess the any swallowing problem, and also help with the development and articulation of speech, and rehabilitation team. And I think that's all.
Yeah, understand. So I think you said everything, the points, physiotherapist, occupational therapist, and other team approach and everything. So you do the developmental assessment and hearing visual assessment formally, and then also the complete history physical examination. But what about the patient notes, patient files, and you review? Because child is in the social service, so you will immediately contact with the social service, and you will search out that any immediate danger with the child having or not. Okay, so if it is there, then you have to note out during the physical examination. You will search anything like in skin manifestations or anything there. What about the school? You have to give the school, and if you complete the history, then you will get that grandmother is very depressed, grandmother is very much depressed, and very difficult for her. So you will arrange some respite care, okay, with the social service, right? So you will involve all the other, the discipline, consultant pediatrician, community pediatrician, don't forget community pediatrician. I don't know how it is, but in the UK, it's very important to say community pediatrician, because community pediatrician will collaborate with all the discipline. So this is also a CP child, we have to remember, but CP with shaken baby syndrome, it is hemiplegic case, so hemiplegia. But during the assessment, what I feel that you said gait later, but it should be early, and any deformity, it should be asked early, right? And then
during the walk.
yeah, so she walked and okay, but if I did not say you anything that right side how, left side how, understand? So you will not get it, right? But if you ask gait, then immediately you get that some problem is there, it's hemiplegic gait. So there is a discrepancy between the two sides. So she can do something on the right, something on the left. She can do something on the right and something on the left. At least if you got that child having discrepancy between the right side and the left side. So she can do all the things on the right side, but it is less, you know, you say rightly 2.5 to 3 years, and not on the left side. So she cannot, okay, but whenever you did fine motor, you have to see that you have to say this, because already you know the case. So is she simultaneously using her left hand or not? Okay, so it should be asked how she is using her hand. So she is not at all, she is not using her left hand. She is not using. So it should be came out from the examiner that no, she is not using left hand. So how she is using? That is the one of the question. So overall, it's I think it's a good example happen all of you to understand the case, I hope. And it will not a problem for you in the exam. Okay, you will practice by this way. I will let you know when is our next class, but I'm happy all over.